Okay everyone, today we have got a very interesting case here. So this gentleman presented himself with a pain or swelling around this region of the foot. So over here, first thing first, during the clinical assessment, we can see that the good thing about the feet is we can always do a comparison. Now you can see over here, you can see that he has got a very clear and distinct tendon showing, whereas here you can only see about the last three tendons showing and also the first one. And here you do see a little bit of bruising around it. So this condition has been, patient has been suffering it for about a month now, and the pain doesn't seem to go away. So it really warrants an investigation. So right now what I would normally do is to pop an ultrasound to see what's actually going on inside. Okay, so we'll try to check from the ultrasound and see what's going on. So here, once we located the position of the foot, we want to slowly check whether or not there is any abnormality in the bones or the tendon or the ligament. So over here what we can see, right, from the ultrasound, if we can show it to you, where we are looking at right now is these two particular bone. The one behind here is this rounded head, and the one anterior or in front is this particular segment. So from here, what I can see from the ultrasound imaging is that there is a very fine crack around this region here. Okay, so once we find out that there's a possibility of a fracture, in order to further confirm it, the best way is always send patient for an x-ray. And yes, we do have this patient go for an x-ray. So here is the result of an x-ray. You can have a clear look. So right now where we are looking at is this area of the foot, and it's the left foot, and this is where we had a lot of swelling. So you can see over here where the bone is, there's a tiny separation between the two bones. Yeah, so there is where the fracture is. Okay, and we move on to the other side. So once we tilt the foot a bit in this oblique x-ray, you can see that it is much more clearer around this area, and you can see the rest is all intact. Yeah. So when patient has got this fracture, for the bone to remodel normally takes about 8 to 12 weeks. Best is to stabilize the region, prevent a lot of movement for the bone to remodel and also to fuse back together, since it's an undisplaced fracture. So normally we'll prescribe something like this. It's a Darko boot with a front offloader. So that means patient doesn't put any weight in the forefoot. So this will allow the bone to heal and remodel. Okay, I hope you guys learned something about toe fracture today. If anyone sustains such a problem, please seek medical attention immediately and try not to self-treat.